The relationship between the young person and the youth worker is so unique because the young person really feels safe with them. They feel heard, they feel seen, they feel connected because it is a space where they are allowed to just explore who they are.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox and today we're speaking about the National Youth Health Programme, and we're delighted to have Rachael Treanor here. She's the manager of the National Youth Health Programme in the National Youth Council. You're very welcome, Rachael.
Thank you, Fergal.
So first of all, I'd like you to tell us a bit about the work of the National Youth Council so that we can put the National Youth Health Programme in context.
Yeah, so the National Youth Council is the representative body for the youth organisations across the country. And then within the Youth Council, there's varying different projects and programmes. So the health programme would be one project that sits under that. And we are a partnership between the Youth Council, the HSE and the Department of Children. So all of our work aims to develop culture of health and wellbeing within the youth work sector.
So the youth work sector, so you're trying to infiltrate the youth work sector with wellbeing and trying to support all those organisations out there working with young people.
Yeah.
So give us some examples so people would get a good feel for the type of youth organisations that you're trying to reach.
Yeah, so the youth work sector is vast. It goes across the country. You have organisations like Fergal, Youth Work Ireland, and then you might have smaller organisations not affiliated with any of those larger organisations. So you would have Limerick Youth Service, Donegal Youth Service. So we expand and support nationally across the country. And a lot of the work that we're trying to do is within a youth organisation. They would offer young people safe spaces to really develop relationships, build their confidence, trying to explore their identity a little bit. And all the work we do is trying to support them in terms of their health and wellbeing. So supporting a young person in terms of their overall health and wellbeing, but also supporting the youth worker and the volunteer, because the youth work sector would be built up by volunteering. So we try and support everyone who's involved in the sector in relation to health and wellbeing.
That's good. So the type of young person that's coming into these youth work spaces then, they've been targeted, I guess, in terms of some level of need or some level of vulnerability or some level of support. They're going through, all young people need extra support, I guess. There's a level of vulnerability with just basic growing up.
Yeah.
So all those youth organisations are supporting young people right across the country.
Yeah, so young people can voluntarily engage with youth work and then other young people might be referred into it depending on their circumstances.
Yeah.
A lot of the time with young people who are going to youth work, they might not have a safe space in terms of what we would call a safe space in terms of home, school. It might not be safe for them. And a youth organisation will provide them with the safe space, and it's built through the relationship with the youth worker, which is really unique. And I think that kind of gets lost a lot in talking about the youth work sector. The relationship between the young person and the youth worker is so unique because the young person really feels safe with them. They feel heard, they feel seen, they feel connected because it is a space where they are allowed to just explore who they are, done in a really non-judgmental way. And a lot of the youth work sector is built on the need of the young person. So it's built by the young people themselves of what they need, what they want, instead of this is what we think we should be doing with the young people. So that's why it's really engaging for a young person because they're not being told what to do. They're kind of letting everybody know what they need, what they want to do. And it could be that they'll come in on a Tuesday and they'll just hang out.
Yeah.
Or there will be a structured programme in place, whether it's talking about mental health, whether it's talking about sexual health, consent. It'll just totally vary depending on the group, but it's always going to be there for the young person and they can drop in and they can drop out whenever they want to, basically.
Yeah, that's really well described. You're nearly capturing the way of working as fundamentally different than the school settings. Then you're trying to empower the young person. And then you're putting an adult, like you said there, the youth worker, the volunteer, in a position where they have to build trust and engage that young person on absolutely anything.
Yeah, it's completely different to the school setup, and which it should be.
Yeah.
We would call it out of school context because it is so different. In a school setting, the relationship between teacher and young person is so different, as it should be, because it's a learning environment. But within a youth organisation, it's still a learning environment, but it's a learning those core competency skills that we all need to thrive. So learning about decision making, critical thinking, relationships, but done in a really safe way. And it might not be through a structured programme. It just could be a chat in the kitchen, a chat over a cup of tea, playing a game of football in the hall. Or it could be like during the summer, they would do a lot of summer projects. So they would take them out to, say, the coast to do paddleboard and kayaking. Teamwork, communication skills as well is a big part of it.
Yeah, so I can see what you're talking about there. You're describing it fairly well, because the out of school setting, from a HSE point of view, we see how important that out of school setting is that you're working in. And as I said kind of earlier, you're infiltrating with health and wellbeing, you're supporting the health and wellbeing content. We have a lot of policy programs and different topics that we're trying to address, and you're able to bring them to people that need it the most at a young age. You're building in that informal curriculum, if you like. Curriculum is nearly the wrong word to use.
Yeah. We would call them structured programs.
Structured program.
Yeah.
Okay.
They are structured in a sense that they would have a start, middle and end, but I
Yeah.
suppose they're very unstructured in a sense that it's led by the young person. So if they decide that they want to do a program on mental health, there's a Mind Out program sitting there that the youth worker knows how to use. There's activities, there's games in it that they can just pull, and it's done in that really informal way, but the theory behind it is evidence-based. It's been researched. So the youth worker knows that the aim goal is trying to support the mental health of the young person.
Yeah, let's talk about that a bit, because I think Mind Out is something that I'm familiar with in terms of its target aim to improve social emotional well-being.
Mm-hmm.
And we have a Mind Out program in the formal school setting, but the program has been adapted for the out of school setting to do what you just said.
Yeah.
And how have you seen that rolling out?
Yeah, so the Mind Out in the out of school setting, we have the remit to deliver, and it was developed at the same time as the schools one. And at the minute, it is one of the programs that we are so busy with. And we deliver a 2-day training, and we do it sort of different in the sense that when youth workers come on the 2-day training, we get them to do the training in the perspective of themselves. So developing their own skills. So like, how does emotions come out in you? Like when you're angry, where does it come out in your body? It's very hard to ask a young person that if you haven't identified that in yourself. So day one can kind of be, it can be scary for youth workers at the start, because it might be things that they mightn't have thought about, like what makes you happy? What are you grateful for in a sense of your personal life? So we get them to do the core modules within the Mind Out. So looking at your understanding emotions, developing relationships, and kind of looking at the happiness element. So we get the youth workers to do that, and then on day 2, we'll run the rest of the activities with them, just so that they can get a sense of how they work. Because the main aim of the Mind Out is to build those social and emotional competencies for a young person. So starting them to think about, what is that emotion I'm feeling? Is there a label for it? Can you articulate how you're feeling? Where is that manifesting in your body as a young person? Then starting to get them to think about, what are they grateful for? For some young people, they might just be grateful for that youth space. There might not be a lot of positive things in their personal life, but the fact that they're getting a space an hour a week, they're really grateful for that, because it's just a space where they can be themselves and relax. So it's pulling all of that into it as well, but also looking at it from the perspective of, can you develop friendships? And how do you develop those friendships? What are the values that you see in yourself that would be seen as being a good friend, but what is it you want to reciprocate? What do you see in a friendship? And then that will lead on to then developing romantic relationships as well. So it's those fundamental core skills that we all have. But if you're not given a space to develop them at a young age, it'll be really hard for you to kind of navigate your way through life, to keep down jobs, to keep down friendships, romantic relationships, and just live a life.
Yeah.
So it's given them that opportunity to really have that critical eye and critical thinking on various elements of their lives.
There's so much in social and emotional learning, isn't it? And the way you've described it there, that there's fundamental skills that we don't know we don't have if we don't have them. And you're giving young people a language and a frame of reference. I often thought, when I was working with young people around that age, I thought, and I'd struggle to keep their attention and things like that. You're trying different things to engage them in a group session, and I was kind of reassuring myself that some of these lads may not need this now, but when they need it, they'll know what we were talking about. Like sometimes they don't have a frame of reference to latch onto. So it's great that you're trying to give them, we call it social emotional skills, but it's literacy for those social engagements and emotional attachments. We need to have a life, healthy relationships.
Yeah, and even for them to realise, like, if they're in difficult situations, are they able to take that step back and realise, well, what am I doing here? Like, can I take that step back? Bringing in that mindfulness element as well. And we're lucky that we have the partnership with the Sanctuary, that we would do a lot of work in that in terms of mindfulness, just giving the young person the opportunity to take a step back, realise what way this is sitting with them, and then they might be able to have the conversation instead of a really negative retaliation that might have consequences coming down the line.
Yeah, that's so powerful. You just have an image of young people getting carried away with their emotions, and you're literally giving them a language to have a space for pause and reflection. and mindfulness, even giving them a framework for mindfulness.
Yeah, because a lot of the time mindfulness, it's a buzzword at the
Yeah.
minute, and there might be not a lot of understanding on it. Like if you ask someone to be mindful, they would assume, right, we'll listen to this recording on the phone and I will be at one.
Yeah.
But for a lot of us, for me, like mindfulness is very much like physical activity. It's where a place where you can go, that you can totally concentrate on what you're doing without maybe bringing in the outside world, that you're kind of in flow. For young people, it can be really creative. Like a lot of young people love art, whether it's colouring in, whether it's music, listening to music. So it's giving them that opportunity to realise this is what mindfulness is. It isn't what you would assume. It can be physical activity, it can be the arts, it can be gardening, baking, cooking, anything that you are in total concentration of and that you're in the flow, whether it be for 5 minutes, whether it be for 20 minutes, just allowing your brain to switch off and stop the overthinking that we all do. And that's why we do it with youth workers first, because it's really important for them to get that understanding as well. What way could you engage with mindfulness? And then it's easier for them to put that message back to young people, because they really do love it once they get it. Like who wouldn't love going into a space where you can just completely regulate yourself in a really calm, safe way, rather than coming in and you're really high strung and you're being told, right, we have to do mindfulness now. Like once you put that label on it, it isn't appealing to people. But once you put the label on it, is what is it that you enjoy? And we'll concentrate on that.
Yeah.
And then you can really deregulate young people and bring them kind of back down and ground them a little bit.
It kind of reminds me then of the importance of activities and doing things. Like the examples that you gave there remind me a bit of the Men's Sheds message about doing things shoulder to shoulder, that you lose your hang-ups when you're in a task. You know, so you're kind of bringing the young people into activities and all of a sudden, you know, they're talking to each other, they might be partnering up on things or trying to solve a problem or trying to, it's great. So what has been the reaction to youth workers to the likes of that? Like, you know, you said they might be a bit hesitant at the start. How have you got them on board, keep them on board?
Word of mouth for the Mind Out has been massive for us, because youth workers have really been the champions for us on it. They've been like, that training has been amazing for us, even just personally. So people go with that lens, being like, no, like my colleague has said that this is really good, so I'm going to stick with it. When they enter the 2-day training, we just set it out. Just throw your professional hats out the window. That's what we want you to do, because it's very rare that you get a space in your working life.
You're doing youth work with the youth workers.
Yeah, exactly. That's what it is. Like, who wouldn't want to go to a 2-day training where you explore all of these things for yourself, and it's done on work time. So yeah, you're exploring it with the youth workers, so that then the ultimate message is so that you can do this with the young people. It's role modelling. It's back to that relationship piece. Young people can see through somebody if they're not being authentic with themselves. So like, it's very hard then for us to ask a youth worker to go back to a young person and do this, because the young person will know, well, you haven't really understood this for yourself. So that's why we give them the space to really reflect, think back on it, what's important to you, and then it's easier for them to then work with the young person on it.
Yeah. And you mentioned sexual health training as well. That's another priority for us. The mental health program that supports the Mind Out that you mentioned there. But we also have a sexual health program, and they've been supporting, working with the National Youth Health Program for a number of years as well, trying to embed those skills, just like you spoke about there in relation to relationships, which are fundamental, and having that reflective space. And obviously you can't maintain a healthy relationship if you don't have those social emotional skills that you mentioned. But in terms of sexual health, tell me a bit about how you're trying to do that.
Yeah, we're really lucky. We have a brilliant partnership with the sexual health team here in the HSE, and they would fund a lot of our training programs. So one of the training programs that we have is understanding consent and talking about pornography. It's a massive issue at the minute in terms of the young people, but it's really building the capacity of the youth worker, that they feel confident in having these conversations with young people, letting them understand what is consent and what does it look like, because we talk a lot about consent in terms of sexual relationships, but consent comes down to everything, whether it's, do you want a cup of tea? No. Accepting that that's what your answer is. And that is one of the videos that we use, is consent the cup of tea. Bringing it back down to that level so youth workers understand, well, this is what consent is. And then scaling it up in terms of sexual relationships or romantic relationships with young people, making them aware of, if you don't want to engage in something or doing something, saying no is an answer. And just building that confidence and self-esteem in themselves, that they can be affirmative and they should know what they like and they dislike. So that's one of the trainings that we do. And then the other one, it goes hand in hand, is the understanding pornography. What we're seeing at the minute is young people are engaging in and viewing pornography online because they're lacking that education piece, whether it is through schools or through home. They're wanting to figure out, exactly what it is, what are they supposed to do. So they're going to pornography, but then we obviously know in terms of pornography, they lack the use of conversations, they lack the use of condoms, protection. But because you're at such a young age, as a young person, you're assuming that that is the way it should be. And you're
it's a
not.
dangerous education medium.
Yeah, you're using it as your education. So we're trying to counterbalance that in terms of this is why young people are accessing it. But this is, as a youth worker, what you should do to engage them in that conversation to make them realise that it's not real life. That's not what it is. Again, it's that confidence piece. It's building the confidence within the young person and making them have that critical view on things, because young people are going to engage in risky behaviours. If you can provide them with the education and support on it, they might refrain from engaging in the behaviour.
Yeah, you're giving them safety rails, really, in a way, and you're giving them direction. And as I said earlier, a frame of reference, because if nobody's talked to me about pornography, or I haven't got it in school, or haven't got it in the youth work setting, then you think this might be real life, or this is, and there is a lot of concern from parents and from people working in the youth sector about the rate of engagement in pornography and the danger that that's doing to relationships, generally speaking. So you're trying to impact on that in a positive way.
Yeah, because young people are on social media, that's how they're communicating with each other. So they're going to access it unless you can put really strict parameters on it, which young people are always 3 steps ahead of us as adults. They can get in and around these things. So the education part is really important, so that you're providing them with the opportunity to be like, this isn't real life, the impact that this might have. And you are probably learning from it, but that's not what that should be. Go to your youth worker, try and have the conversations about it. You're trying to stop them from really going down that direction of watching it.
Yeah, you're giving them great guidance as well in terms of this role play, or giving them examples where the consent is all the way through.
Yeah, consent isn't just about romantic relationships.
Yeah.
The first word we learn as a child is no. And then we start to, you're kind of changing it down to be like, no, you have to say yes, you have to say yes. But no is a word that we should be all using, and bringing it forward, and just having confidence in yourself to say no and stand by it. And even when someone says no to you, accepting it. That's a big part of it as well. Just accepting, okay, they said no, I'm not going to push that any further.
Yeah. Isn't confidence so fundamental in young people's risky behaviour? Like you said there a minute ago, young people are going to engage in risky behaviour. That's a fact that we can't get away from. We're trying to put up safety rails, give them guidance, give them a frame of reference. If you're going to do this, you need to watch out for that. People have fallen down here. These are risks. But the person's confidence, if you can build up a person's confidence, they're much more likely to be able to stand on their own 2 feet and not get too pulled into that, whatever it's going to be.
Yeah. And that with the before you decide training that we have as well, that's basically what that training is all about, is trying to support a young person's self-esteem and confidence in relation to their sexual health. Because sexual health spans over friendships as well. So you as an individual just really being confident in yourself and being to articulate in a friendship and communicate really effectively in terms of what you want to do, what you like, what you don't like. Because it comes back to that. If you can't do that in a platonic friendship, it's going to be really difficult to do that when you start engaging in romantic relationships as well.
Yeah, no, that's well put. And the before you decide is another one that's supported by our sexual put. Yeah. So that's been on the go for a while now, isn't it?
That's been on the go, a couple of years, and it's been updated, and we actually have spent a lot of time the end of last year and this year refreshing it again, because when we're very lucky in the health programme that we sit really strategically in terms of we work at the grassroots level, so we're meeting youth workers day in, day out, we're hearing what's coming up. But we also work at the strategic level in terms of supporting policy development and informing funders. This is what's going on for a youth worker. So we know what's going on for young people is the confidence piece, to be able to have those skills around language, just to be really assertive in themselves. So we knew the Before You Decide is the programme that we should be trying to run out. So we spent a lot of time kind of refreshing it and refurbishing it, basically, to run it again this year in 2025. So people are contacting us about it, which is great. And again, it'll be that word of mouth piece for us in terms of youth workers really selling it for us to say it is effective, it is working.
And what other issues are coming up from youth workers? When you're taking feedback there, you mentioned that you're listening and engaging with them. What are their big concerns around young people that maybe we don't have a programme written about?
It still always comes back to anxiety.
Anxiety.
At the minute is still massive for young people. whether it is generalised diagnosed anxiety or it's the everyday anxiety that we all feel, that's still a massive piece for young people at the minute, and especially for young people who might have transitioned from primary school to secondary school during the pandemic. There will be anxiety around social interactions, engagement with people, because they missed those fundamental life leaps that we all should make. So anxiety is still a major problem out there. But then it's layered on top of that with vaping, with drug taking. It all kind of goes in a cycle because they all interact with each other. So young people might engage in substance misuse to alleviate the symptoms of anxiety and how they're feeling. But once the substance wears off, it just heightens the level of anxiety. And then they can engage in a really dangerous cycle that can ultimately lead to more devastating consequences in terms of depression, suicidal ideation and different things like that. So that's why it's so important to go in at that prevention, early intervention stage, so that a young person isn't getting to the point where they might be
getting caught up in a negative cycle like you just described there.
Risky behaviours,
I know our tobacco program are extremely concerned about the rise in vaping, and that message is coming through to me from the youth sector that there's a massive concern out there, and we're hoping to be able to develop a vaping campaign this year or next in terms of being able to respond to that big growth. But we've highlighted it. There's a number of documents on the HSE website around vaping and the dangers of vaping for people working in the youth sector. I think that's very important to call out. So you're working with youth organisations and you're trying to build up their capacity. And one of the ways you have of doing that is to get them to look at their setting, become a health promoting setting. Can you tell us a bit about that?
Yeah, so we have an initiative called the Health Quality Mark, and it's a process in which an organisation will engage in to become gold standard in health promoting. There's various different stages that organisations will have to go through. At the minute, we have like 30 active Health Quality Mark organisations spanning from Letterkenny to Killarney, KDYS, so they are across the country. But what they will do is they will engage in the process of, they will send someone within the organisation to take part in a specialist certificate we have in partnership with the University of Galway. So it's a certificate in health promotion, youth health promotion, where you will learn the principles and the practices of what health promotion actually is. And then you'll go back to your organisation bringing this learning, and we support you in terms of looking at your organisation in a whole with the view of health and wellbeing as the centre of everything that you do. So you're looking at your values of the organisation, and is health and wellbeing named? Is it there? You're looking at the policies that you'll have in place, and is everything involving with the aim of supporting the health of wellbeing that everyone who walks through the door, not just the young people, staff and volunteers. So it's a partnership piece we do with them. There's 3 levels of the award. There's bronze, silver and gold. There's 12 criteria that they have to meet. So if you meet all 12, you're a gold standard. If you meet 8, you're a silver, and then if you meet 4, you're a bronze. It doesn't mean that there's less work. It's work involved in it all, and usually we really encourage organisations to start at the bronze level and work their way up, because they're doing a lot of the work anyway. It's just putting that view of health and wellbeing at the centre of everything that you do. So we will go in and we will support the organisation to look at themselves holistically in terms of health and where they think they fall on and where they think they're really, really good on, and really just promoting everything that they do. And then they will look at themselves in terms of planetary health as well. So like, what are they doing in the organisation that will support planetary health? They'll have a range of different projects that they'll do, whether it's junkature. Some organisations, like there's an organisation in Sligo, have allotment that they bring the young people out. It's a 2-way piece. It's supporting the planet and its planetary health. It's a bit of mindfulness as well, but they're also learning about nutrition, the value of growing your own fruit and veg. So it's a 2-way process.
So it's sparking ideas. So let's say if I'm the youth worker for my youth organisation, I go along to your training, and then I go back to my base and say, lads, they wanted to do a plan for the whole place. It's not just me. How have you found that? The centre is responsive to the people being trained up. Like the way you're talking about it there, it seems to have latch-on areas for loads of different areas.
Mm-hmm. The centre is really responsive because it's usually management that want to have the award within the organisation. So once you have that top-down approval, it's really easy for staff to bring this in. So management will approve, and then we, as the health programme, we'll go in, because we won't leave it on the person that has done the cert to try and do this themselves. It's the partnership piece. So we'll come in and we'll do team days to really explain the process that's involved, what the health quality mark is, the benefits that it will have on the organisation. but really calm them in a sense of this isn't an additional piece. You're already doing the work. It's just putting that view of health and well-being and putting that lens on it for you to realise the benefits that you're actually having for the young people here, for the staff, for the volunteers, for anyone who walks through the door, basically.
That's really good. That's really good. Can you give us some examples of some of the gold organisations or give them a shout out?
Yeah, give them a big shout out. So, for example, we have over in Sligo, as I mentioned, the Sligo Youth Reach, they're a gold standard. So their organisation has basically met all the criteria to be awarded the gold. So they would look at different things with always the view of health and well-being. So as I said, in terms of they've built an allotment, they just made use of the space that they had and realised the importance of outside work with the young people, especially like young men. That's how they'll engage in them in terms of, you'd mentioned earlier, the side to side.
Yeah.
They knew that the outside work would really help the young men. So they have this allotment. And
so visual as well in terms of seeing something grow. I mean, if I plant something, I see it grow.
Yeah, there's a sense of achievement with it. And it's not that it's done structured like, okay, Monday morning, 10 o'clock, we're going to go out here. It's there just so that people can just walk in and out and do as they please with it. So Sligo would be our gold standard. And then other organisations that have started the process would be smaller organisations like one out in Blanchardstown, the Neighbourhood Youth Project. And they're basically at the start of their journey with us in terms of they sent two to do the certificate. And now we're working with the team to give them a sense of, okay, what's involved here. They're already meeting criteria in terms of like child protection, inclusivity. But we work with them now to develop their health promotion policy and get their team involved so that they know, okay, this is the way that we're going to work. And this is how we'll implement the health quality mark within our organisation.
Yeah, it must be very rewarding for those centres to see brought through a process of reflection themselves. Like we mentioned earlier, doing youth work with youth organisations. You're bringing the organisations on a health and wellbeing journey to bring a lens to the health and wellbeing work and showcase it and amplify it where they need to.
Yeah, we celebrate them when they get their award. We would always say to them, we'll come down, we'll present you when you're doing a celebration of something, because it is an achievement for them to do it. Especially some organisations might only be 2 or 3 youth workers within the organisation. There might be volunteers, but the youth workers are the one that are really taking on this role. So we really want to celebrate everything that they do, but we also feel that we love giving them the opportunity to network and to engage with other organisations around the country, because they might be facing something that they have no expertise in, but there could be an organisation in Galway, for example, Number 4 Youth Centre in Galway, that they're very au fait with what that need is, and we'll get the two of them to talk, to link up. And it's just that networking piece as well, just making that relationship and understand what is going on across the country and how can we better our young people within our centre.
Yeah, I can see that network can be essential, working with vulnerabilities. Very difficult to have an answer for everything, isn't it?
Yeah, and like different areas and pockets across the country have different needs. It's not a blanket, like what's happening in Dublin would be very different to the need that's going on in, say, Kerry or Donegal. So we don't take a blanket approach. It is very much flexible in terms of the organisations.
Well, just as we come to the end of the podcast, and thank you so much, Rachael, for all those insights on your work. But one of my reflections is the importance, you mentioned them a few times, of volunteers and youth workers in sustaining this work with young people. Like they're the foundation stone, isn't it?
Yeah, so the youth workers and the volunteers are basically key to the youth work sector. Especially volunteers. The youth work sector would be built on volunteering, but youth workers are key to what they want to try and achieve with young people. So we as the Youth Council, we're eager that we're at the start of a 5-year term with a new government, and we would hope that health and well-being of young people is at the forefront of what they're wanting to achieve, but using the youth work sector as an infrastructure to support existing services. So to support CAMS, to support other therapeutic services, because at the minute, youth workers are a holding space for young people who are waiting on appointments, who are waiting on maybe referrals. And unfortunately, the youth workers are doing what they can, but they're not adequately funded.
They're not clinical staff.
Yeah, and they're not resourced properly. So to really put the investment in the infrastructure so that they don't have to turn out to be the clinical staff, they can support the young people as they are already doing while they wait for their appointments into the other services that are available to the young people.
Okay, so that's your call out to government to support the supporters.
Yes, basically, yeah.
Okay, very good. So in terms of people finding out more about your work, Rachael, where do they go?
Yeah, so they can go online to our website, so it's youth.ie, pretty simple. When you go on the website, you'll see the different projects and programs that are involved in that. NYCI Health is one. We have arts programs, we have child protection, and there is a range of resources and trainings that are available. But specific to the health program, you can click on the health part of the website and you'll come across everything that we do. But one thing that I do want to highlight is our signposting tool that we have developed. In 2015, there was a massive needs assessment done within the youth work sector to understand what the needs are in terms of mental health. But one thing that was identified was where would we go for services? What services are available out there? We all know there's a range of services available, but there wasn't one place where people could actually access that. So what we done was we developed a signposting tool of a national call out to see what was available within Ireland, basically. So you can go and click on your county, and if you are struggling in terms of you need support in terms of anxiety or neurodiversity, you can click those tags, and within your county and your area, you will get what supports are available to you. So we have family resource centres on there, we have youth organisations on there that provide that therapeutic support. But then we will have the national services as well, but we have them scheduled and put online that they have the local numbers that you're not really going to be ringing and getting a bot. You're actually going to be speaking to someone on the phone. It's taken that barrier down for young people so that if they are scared to make that initial phone call and they're afraid that nobody's going to pick up, that they actually have phone numbers and names of people there that they can make contact with. So if you go and look at the signposting tool and your organisation isn't on it, you can let us know, because we want to keep it live. We want to make sure that there's the most relevant information on it. We can add on your service to it.
Okay, great. Well, I'd like to thank you for coming to speak with us today, Rachael Treanor, Manager of the National Youth Health Programme with the National Youth Council. Thanks for joining me today. And I'd like to thank you, the listeners, for joining us on another episode. If you'd like to get in touch with Health and Wellbeing, you can email us at healthandwellbeing.communications@hse.ie, or you can follow us on X or LinkedIn. And thanks for tuning in to another episode of the HSE Talking Health and Wellbeing podcast.